now the next session, I'm going to move over to, oh my gosh, Tara or Tara? I should do it.
That's okay. It's Tara. Hi, nice to see
Tara,
you.
thank you.
Yes.
Wow. So the worst part about this, Tara, is we've known each other for many years, and yet here I am forgetting how to pronounce your name.
I think often we're on different sides of the podium, so it's great
It's
to see
very
you in
true.
this setting.
Yes. I've seen you for many, many years, and usually we're waving to each other across
It's
the
very
hall. But
true.
so I've told all the other speakers, Tara, I am running this very low key and comfortably, as we can see, but I'm also not doing introductions. I'm going to let you introduce yourself, but thank you, everyone. We're going to now move into the afternoon session, and I'm going to turn it over to Tara. Another topic that I'm just so excited to hear, because I'm a big believer, especially with AI and technology, where more medical decision making may become automated. I think our role, the importance of communication in terms of with patients, with colleagues, really is just going to grow. And I'm excited to hear over the next hour how Tara can help us with that. So Tara, it's all yours.
Thanks so much. It's great to be here. I'm going to share my screen and make sure that is working for the group. All right. You should be seeing something very orange. I'm glad to see that. Thank you so much for having me. My name is Tara Traeder, and I work with a group called Point Take It Consulting. Michael mentioned that, we often see each other on the other sides of podiums. Our team supports speakers to give the presentations that make the most impact for them. My background is in social science. I have a PhD in health communication. And so like you, I'm thinking about how do messages about health influence people behaviorally, cognitively, and emotionally. And today's session, I want to go through a few tips and techniques that you can use in any healthcare setting. Many of these tips might sound familiar, but my goal today is to put them in the context of the work that you're doing as providers and clinicians, and how you can also expand these techniques and tips in settings that might be beyond the clinic. As I'm going through this, what I'd like you to be thinking about is how can I apply this tip or this suggestion or this framework to work or life that affects you. And as we go through, I'd love to hear a collection of those start in the chat. And then at the end, we can go through some examples or questions that might be relevant to you and how you might apply some of these ideas. As I was thinking about this group and presenting to you today, I was thinking about, what are the contexts or the settings in which you're talking to people, communicating with others. And so I did a little bit of brainstorming on my own, and I want you to do some right now with me. So I'm going to click through and tell you some of the ones I was thinking. Feel free to write into the chat others that you come up with, or keep them in mind, and we can talk about them at the end during the Q&A. And so the first and probably this most simple way in which you communicate with others is in your clinical practice. That patient-provider communication, as well as with other peer-to-peer, other groups within your practice. So clinical practice is, as in your work life, one of the primary areas that you are communicating with others. But what are some of those other examples? One that I was thinking about was administration and leadership. Many of you work for larger practices or hospital systems. There's ways in which you want to communicate to the administration and leadership of those institutions. And there's ways in which to apply communication frameworks that's different than how you might do that in clinical practice. Another setting I was thinking about is public health and your community. How do you communicate with others around you to make sure that messages about health are having the impact that we need in our communities and in the public sphere? I also thought about media and public relations. We're here on a conference today. Like, these messages might be going out into the world and might be picked up in social media or with other media outlets. And are we getting those key ideas out to the right people in the right way? Another audience that came to mind was education and development. If you are in the academic realm, or some of you I hear are just coming out of PA school, maybe academia was a big part of your life, going to congresses, going to conferences, hearing educational talks, how can you apply positive, effective communication frameworks in that setting? to have the most impact. And then one other area that I was thinking about is industry partnerships and ways in which clinicians can work with industries like medical device and pharmaceutical, gene therapy, other industries that you can partner. And how can you apply the communication frameworks that are pretty ubiquitous to that setting as well? So throughout this talk, my intention is to give you 5 key tips that I think you can apply to any of these settings. My approach today is going to be to take each of those 5 key tips and apply it to one of these areas. But that's not to say that every tip isn't applicable to every single area. As we're going through, I want you to be thinking about, all right, Tara, that's one idea of how it could be applied. Here's another one that I might be thinking based on my own context of the world. And I would love to hear about some of those ideas and questions you have as we get through to the end of the talk. I mentioned to you that there were 5 tips that I wanted you to remember today. And I would be remiss if I didn't connect that with our company, Point Taken. So today, I want you to remember the 5 tips based on the word taken. And the first one is for T, tell a story, connecting your ideas and content in a way that becomes memorable to your audience. That is going to have the most impact and allow yourself to be the most persuasive in how what you want connects with what your audience might want. So T, first tip, tell a story. A, thinking about the audience's perspective. So audience-centric communication and explaining ideas from your audience's perspective. Audience is everything. The same message to a different audience could have far less impact if you're not clear and focused about what they need and how to reach them. And I'm going to give you an example of how audience might impact a message later on. So we have T and we have A. K is articulating the key message. So often when people give presentations, they give a whole bunch of information, but they leave the responsibility of why does this matter up to the audience to figure out versus having the speaker articulate that for the audience. And that's a huge part in making sure that your content is focused and memorable so that your audience will take it with them. So now we have TAK. The E in taken is for engagement. Creating engagement and interactivity in any presentation or any communication setting requires planning and thinking in advance. How do I want to connect this audience? How do I want to make a difference to them and make it meaningful to them? And I'll give you some tips and techniques that you can use in many settings to create engagement with your audience. And then finally, one of the most important things we can do as presenters and communicators is manage our nonverbal physical delivery skills. I'm going to go through what those skills look like to help you show up confident and competent in both a live setting as well as a virtual setting. And I'll give you some tips to do that as we get towards the end of the presentation. So this is our plan today. I'm going to walk through each of these 5 tips, and I'm going to apply each one to one of the audiences I had brought up earlier. Now, your homework as I go through this is to think about what are other audiences that this might apply to, and how can you put this into practice both in the clinic as well as outside the clinic. Our first tip is to tell a story. Now, I don't know about you, but my son is crazy about Marvel and Star Wars and all of these hero stories. And the storytelling framework that speakers use and communicators use to persuade others and to create connection, it's the same story arc. You start with a status quo. Everything is fine. Luke is out there, nothing's really going on. He's living his life. And forgive me, my son knows way more about Star Wars than I do, but it is a great example of how we can apply story framework. So everything's fine. There's no problem. And then all of a sudden, an asteroid hits the farm and something has changed. and there's a big problem. And so once that inciting incident happens, then you have to figure out, where did it come from and who brought this and is it something bad and what happens? And they figure out it's this bad force and they have this decisive moment. They have this big battle and the hero comes out on top. And from there, the hero realizes their life will never be the same and they're going to fall and the action falls. And finally, they live in a new reality at the end. So one of the most important pieces of storytelling in any communication context is that there is a way to grab someone's attention at the beginning. There is the key, the thing that's happening or the problem or the issue that occurs is that decisive moment in the middle. And then you end in a different place. Something has changed at the end. And that's how storytelling allows us to create that persuasive energy. You might be asking yourself, how can I apply this to my work, storytelling in any setting? And the group that I wanted to apply it to, and I want you to be thinking about others, is administration and leadership in institutions where you might be working. And I was thinking about this, that in any setting, there's challenges that come up in your practice. And I had one that I was thinking about, also because it's relevant to my own life, is the idea of sports physicals. Maybe you have a pediatric practice and many people are calling you wanting a sports physical. The fall time gets really busy and you have all these sick people and all these well kids and everything's a big mess. And so you think about, what is the overarching goal here? The goal here is to get as many people seen so that they can play their sports and you can address that challenge with your patients. But who might be standing in that way? And in this case, it could be the administration and leadership. So you think, what's the status quo? I'm going to go to leadership and ask them if we can have a sports physical day where all we'll do is see the sports physical students. So you start, the status quo is we're getting all of these phone calls and asking for appointments and asking for forms to be filled out. And it's overwhelming our administration staff and it's overwhelming the nursing staff. It's overwhelming the team because we have to do it with everything else. So we go to the administration and we say that decisive moment. We say it's building up. It's too much. If we had this decisive moment, if we had a sports physical day, that would relieve the pressure and allow us to have a new status, a new resolution, a new status quo, where every year we tell families, we will do sports physical day on this day, and you can announce that and you can put that out into the community and they can know that's when I can come and have a sports physical, and you relieve some of the pressure for your team. And the way in which storytelling lives there is that you paint that picture of the pain that the team is facing in getting these calls and feeling this pressure and the stress it's causing families. And what would resolve that is a specific day where it might be costly, it might be something that's different, or having people come in at a different time, but it's a way to address this problem. And so you go in and you persuade administration and leadership for this new approach to sports physicals with the team. So no matter what challenge you're facing, telling that story and having your ultimate goal in mind is going to help you use the story framework in a way that's persuasive for any audience. If you have slides that you're presenting, you want to think about the entire slide presentation as one story versus what we often see of on this slide, on this slide, on this slide. We want to tell that bigger picture and create a cohesive story for the audience to follow. Now, you'll know when we were thinking about administration and leadership, I was thinking to myself, what motivates them to even want to do a sports physical day? What would motivate them? Well, streamlining efficiency, reducing costs, adding more patients who have a good experience with sport physicals. Maybe they start coming into the practice. Those are motivators for administration and leadership to make a change in how you practice. And that thought, or those questions I was asking myself, brings us to the A, the next letter, audience analysis and audience-centric communication. So no matter what communication element you're thinking about, you want to think about your audience. And I love that Mike brought up the idea of AI, because AI can be really helpful in how can I frame this new challenge that this patient might be facing, not giving them any personalized patient health information, but you could say it's a new family with a new baby. It's their first child. They're very, stressed. about what might be happening with them. And this baby needs to have some genetic testing. How can I frame that to this audience? Well, you can use AI to help you create framed conversations. How might that make the most sense for that audience? But you need to train your AI effectively to sound in the voice and tone that you want to have as a practitioner, and also be relevant to the audiences that you're talking to. So these key questions, excuse me, these key questions are the ones that are going to help you frame your ideas for the right audience in any setting. Asking these questions in advance. Now, when you think about audience, you as practitioners are in a different place. And so with anyone with expertise, I always remind them to remember the curse of knowledge. And the curse of knowledge is the idea that we forget what we didn't know before we knew something. So we just heard this great presentation by Frank, and he was talking about financial literacy and how you as a provider can elevate your financial status and plan for the future and accomplish these goals around your financial health. There are topics and words and language within that context of financial literacy and financial health that Frank knows really well, but we might not, because we don't know as much about that topic as he does. And so whenever you're giving a presentation or whenever you're communicating with someone, you want to be thinking about not only who they are, what do they know about this, what motivates them, what are their barriers, but where should I start from? What do they already know? Where does their understanding start so that I can build off what they know? Versus if you go to a place where you're over explaining baseline details, the audience is going to turn off. They're going to be like, yeah, I already know this. Why are they telling me this again? Or if you're speaking too high to an audience, they're not going to be able to keep up with you because they're not going to understand some of those baseline concepts. So understanding what your audience knows and building from that point is the best way to stay connected and build understanding as you go along. And the audience that I was thinking about mostly when I first thought about this was the idea of public health and community. Now, we know that sharing messages about public health or health messages to a wider community, you have a huge range of what people know, think, believe, and understand about a topic. And so let's think about the idea of parents and safety seats. So you have all of these guidelines for what parents should be doing on keeping a kid in a car seat or not. And then you have all these definitions from car seat companies about what institutes a booster seat and what is a rear facing and what is a transition seat and a baby seat. There's all this different terminology and language that can make it really challenging for people to understand what they actually need to do and when they need to do it. And so thinking about who is the audience I'm talking to right now and how can I frame that message in a way that best connects with what they believe, what they think, what motivates them, what's preventing them from doing something, and what do I want them to do? So now we're combining those two ideas of telling a story, what's my goal, what's going to persuade and motivate someone, and where do they stand so that I'm telling the right story to the right person. And so audience-centric communication in any setting is going to make sure that you're giving the right message to the right person. Our third tip is key message. We see this a lot when we see people give presentations, and maybe there's a lot of data on the slide and there's a lot to understand. Unless that speaker is able to really quickly and easily pull out the key messages, you're going to get lost in that presentation. And so we often recommend to speakers a 3-step approach to handling any content, whether it's a slide or a handout or a chart. But we tell them, first, tell us what you're looking at. So what you see here is a framework for handling slide content or content in any setting to make sure that you're hitting on exactly what your audience needs to know. First, I'm going to tell you, what are we looking at? That's the overview. Then I'm going to pick out key data or examples that are relevant to this audience, really being mindful that I want the most salient points that are most relevant to this audience. So now we're combining the last 2 letters, tell a story, audience analysis, with now focusing on the key message that's relevant to that audience and in that context. And no matter what, we are leaving them with that key message or teaching point. What often happens when people present content is that they tell you everything that's on the slide. They say, this is, these are the facts, but they don't tell you, why does that matter to me? What am I going to use that for? And that key message or that teaching point is what people are going to remember most and walk away with feeling like they've really learned something from you and they understand your perspective. One thing I see a lot in presenters is that if they don't give the key message to the audience, you run the risk of the audience coming up with a key message on their own. And then they might have a different key message than you have for the talk that you're giving at that moment. And so it's a 3-step approach. What are we looking at? What are the data or examples that help bring out your key message that's relevant for this audience in this context? There's lots of key messages that can be shared in any setting. There's lots of ways that we can connect with others, but you want to think about first, what does your audience need to know? And this is where oftentimes all of us as scientists, we think, well, there's this huge world of information that someone could possibly know, and I want them to know all of the details before I get to that thing that I really need them to remember. And my challenge to all of you is to start with what someone really needs to know. And here's what might happen. If you do this well and you think about your audience and you consider your context, what might happen is that you tell them what they really need to know. They are going to ask questions or build on that to better fill out their own perception of what they could and should know. So instead of us telling someone that huge picture, focus on what they really need and let them ask questions and build out where should you be adding more detail to make this relevant to that audience. And what would be an example of that? Well, media and public relations. You have very small amounts of time that you're able to connect with someone else. You want to make sure that your key message is clear, is accurate, and truly represents your meaning and what you intend to say. So for focusing your key message and not letting your audience be responsible for figuring it out what your key message is. You have very little time in these settings. So I was thinking about what could be an example of a data slide that I might share with you to articulate this structure of overview, data or an example, key message or teaching point. And I found some CDC data on TB cases. So these data were taken from CDC, start up until 2022. And we're looking at both the case rate as well, the cases, the number of cases, as well as the incident rate. So how much TB is in the population of the United States. And so it's a communicable disease. It's important for us to know where are we in the context of the population having this and how can we address it. So here we see the data. This is the chart that's offered by CDC that is given to the audience. Now, what often happens when people present these type of data is they start by saying, okay, these are TB cases and incident rates by origin of birth in the United States from 1993 to 2022. By saying that, I've just reread the headline of the slide. Now, that is telling me what the overview is. But by reading directly what's on the slide, you've lost your audience because now they're saying, okay, yeah, I can read that too. You want to be the storyteller. You are the person that's telling these data in a way that makes it human connection and allows it to be more remembered. So overall, what we can see when we look at this is that cases are falling and rates are generally falling. We don't know what's going on with the different colors. I'm about to tell you that. But we do know that overall cases and rates of TB in the US have been falling over the last 30 years. What does that mean for the different groups? And so we see the pink are people that were born in the US and the blue are people that were not born in the US. And if you look overview, so the overview is we're looking at data that show the cases and the rate of incidence for people in the US who are both born here as well as people who were not born in the US. The pink are people who were born in the US, the blue are people who were not. And what we see is that in the 90s, people who were born in the US had higher incidences and cases of TB. As time goes by, case numbers for people who were born in the US drop, while cases for people who are not born in the US get bigger. But the incidence rates continue to fall for both, but continue to remain high for those who were not born in the US. And so what does this mean? It means that we need to be targeting our efforts at managing TB in populations of people who are not born in the US. That's where the case and the incidence rates are higher. So in terms of that framework I gave you, I told you, what are we looking at? A few specific data points or key messages to point out. And then the key message, where do we need to target our attention? What are we going to do with this? So not just what is, why does this matter? Or what can we do with it? Now, are there more than one key message? I hope you on the other side of the screen are thinking, wow, I thought of a different key message for this slide. I hope you do. That is the beautiful thing about each of us being our own storytellers and telling stories to audiences that matter, both to us as the person sharing it and to our audience as the person who is listening to it. There's way more than one key message that can come out of this or any other content. But what you didn't hear me do is mention in 2022, there were 2,142 cases of TB in people born in the US. You're never going to remember that number. And it doesn't matter for the overall story and the key message that I was getting at. So that key message, that is the third tip. So we have tell a story, T, audience analysis, A, key message, K, and now we're getting into E, engagement. Planning interaction is key to being able to both capture engagement with your audience and maintain it through a talk. Now, this is didactic, what I'm doing right now. I'm presenting, you're over there listening, and my entire goal is to make sure that my presentation moves through examples, stories, elements that bring you back to attention. Because we know that when people are on the other side of a screen or even in the same room, they get distracted really easily and really quickly. And that's natural. That's normal. That's okay. If you're saying to yourself, wow, I was distracted, and then she seemed to sort of call me out, and now I'm back. Wonderful. Welcome back. That's okay. Engagement is something that as a speaker, I have to work really hard to make sure I maintain throughout my talk. So let's see what often happens with attention. So we know that over time, with a traditional lecture, we all start really engaged. This is going to be exciting. Here we go. We're all in it together. And as time goes by in the talk, we start to wane and we start to get distracted and we start looking around and we just start kind of losing our attention. And then a speaker says a few magic words and it brings us back. And what are those magic words? You might be thinking to yourself some others, but some magic words I hear that bring me back to attention are in conclusion, or to wrap things up. It's like, whoop, we're back. Okay, let's go. But unfortunately, for me as the speaker, if I let that happen, where I let the audience lose engagement for the entire talk and then come back right at the end, they've lost my key messages that I was bringing to them throughout every point in the talk. And so what can I do instead? At Point Taken, we are baseball fans, and we call it a changeup. In baseball, a changeup is when a pitcher comes out and a new pitcher shakes up the game and is going to throw new pitches, and the batters have to kind of think about how they're going to hit the pitches differently. A changeup is something that we suggest every speaker do to keep their audience engaged and keep people returning when they lose focus, which is natural and normal. And so what do? This is what a changeup might look like. At different points in your talk, planning ahead to create engagement, create interaction so that your audience continues to come back to you. So when you're in a virtual talk like the one I'm giving right now, I want to plan points of engagement every about 5 to 10 minutes. So about every bit of that time, I want to be adding a point of engagement. And I'm going to tell you what those engagement examples can be in just a minute. In a virtual setting, every 5 to 10 minutes. In a live setting, every 10 to 15 minutes. You want to pre-plan where in this meeting, in this presentation, in this conversation, am I going to add a point of engagement to make sure that my audience stays connected with me and stays connected to my content? So that's the timing that you want to be thinking about. Audiences are a little more engaged longer in a live setting than they are in virtual. In virtual, there's just so many good things to distract us, like email and pets and all kinds of other things. So keep that in mind when you're planning your engagement. But what does engagement look like? There's many different ways that you can create engagement in your presentations, in your communication, in your meetings that have nothing to do with us interacting with each other. One thing that I've been doing throughout this presentation to try to bring this back to attention and make it relevant to you is adding these personal stories and anecdotes and examples that point back to how the concepts are applied in a real life setting. So as you're thinking about giving a talk about clinical practice or your experience as a clinician to people who are outside of that, what kind of stories, examples, or elements can you illustrate the concepts that you're trying to convey? And you want to be thinking, as you're planning your talk, when am I going to be giving data and key facts? When am I going to be giving illustrative examples that bring people back? So that's personal stories or anecdotes. Another thing you can do is asking questions. Now, in this context, I'm asking rhetorical questions. I'm saying, I want you to think about what other kind of audiences you might be facing and experiencing as a clinician, both in your clinical practice and outside of that. So I'm asking rhetorical questions, asking you, challenging you to think about the content as I'm going through it. Fascinating fact. So telling you that every 5 to 10 minutes, you want to include a piece of engagement that brings your audience back. That's going to make sure your talk remains engaging throughout and brings people back to attention. Quotations, this can be really helpful if let's say you're talking back to that administrative group on whether or not to offer the sports physicals, telling them, I had a patient call in and tell me, whatever they told me. That quotation can add to your story and create more engagement than just telling administration, I think we should offer this sports physical day. It's going to help patients. The shared view is an important technique to use, especially when your audience might not believe the same things you do. Let me give you an example. Shared view is this idea. So let's say you go into a meeting and you have someone who's really resistant to offering this new thing that you want to do in your clinical practice. They don't want to do it. They're not really sure. We can use the sports physical example. So you go into the administration, they don't want to do it. They think it's going to be extra time, extra days, not necessarily the payoff that's going to be beneficial for the clinic and cover the costs of doing that special day. But you go in and you start with a shared view and you can say, we both agree that keeping our patients happy over a spectrum of when they need us is the most important way for patient retention in the long term. So that shared view, the administration can say, yeah, I do agree that the more patient satisfaction we have keeps them with us the longest. And you could say one of the ways in which patients are not feeling very satisfied with the practice is their ability to come in and get the sports physicals completed. So that shared view at the beginning lowers some of that imbalance in what you believe and what your audience believes. A shared view can be really helpful when you may not agree with someone else. And so where can you put this in? The one that I was thinking about quite a bit, mostly because here I am giving a conference talk, and I'm sure some of you will be doing that as well, is where can you include engagement in conference presentations? And so, we've all been to conferences where people are sharing really exciting science and clinical information and new data, but the talks are just not very exciting. And the ways in which I would tell those speakers to add emphasis and add engagement is by asking rhetorical questions, even saying something as simple as, so what does this mean for patients? And then a nice, healthy pause. That's going to bring the audience back to attention because they're going to say, oh, she paused. It's a different tone. It's a different cadence than what she was speaking before. Often when we hear people give presentations, it sort of stays in this range and they start and they don't stop until the end. Adding that emphasis in pauses and rhetorical questions is going to bring the audience back and listen to that next thing that you say after that pause, after that rhetorical question. So being mindful to create this engagement before the talk. Go through your slides, go through your content, go through your meeting agenda and say, this is the place where I want to ask a question. And being mindful to plan the question in advance. Often we get into these patterns of asking the same types of questions, closed-ended, open-ended, and we say to ourselves, how does that plan sound? Well, the possible responses to that are yes or no, versus tell me what you're thinking about this plan now that you've heard all of the details I presented. Now that's open-ended. You want them to share feedback. You want to create discussion and dialogue. So this can be used in tandem. Open-ended, closed-ended. There's no right or wrong in that. Closed-ended questions, yes or no, can help if you're talking to a group and giving a presentation and no one is communicating with you. You could say, how many people have seen a patient that fits that profile? Oh, okay, you have your hand raised. Do you mind sharing a little bit about what that experience has been like for you as their clinician? So now we've coupled a closed-ended question with an open-ended question versus the dreaded crickets. You're giving a talk virtually, you're giving a talk live, and you say, all right, what questions do you have? Crickets. In a virtual setting, the technique that I always tell people to do to create that engagement is to queue up the question. Earlier, I told you people are getting distracted. They're doing other things, and that's okay. So if you are talking, and ask a question to the group, say, okay, do you think we could implement this process? And you call out, you say, Jane, what do you think? And Jane most often says, could you repeat the question? It's because Jane was distracted, didn't hear the question in advance. So the queue up question technique is to say something like this. All right, I've just presented the plan for how I think this might work. I'd like to go around and ask the group their thoughts about the plan and how they think it might affect their individual departments. I'm going to start with Jane and we'll move around the room. So I'm curious from everyone, what do you think of this plan? And how do you think it will affect the department that you work in? Jane, go ahead. So now I've given Jane a ton of warning. I've queued it up. I've told her the question. I told her I'm going to ask her. Now she's listening. She's like, whoop, I'm back. I'm going to be able to answer this question without that dreaded, I'm sorry, can you ask it again? What was the question? Can you repeat the question? And you lose that power and that cadence in the way that you communicate. Questions as part of engagement are a key piece, both in rhetorical as well as how you manage questions when they're said and spoken to you. But more than anything, in all of this, the moment you step on stage, the moment you step into the camera light, the audience is making a first impression of you. And I want you to think right now, how long do you think it takes to make a first impression when you're giving a presentation? I've been doing this a long time, and I think most often I hear 10 seconds, 3 seconds, 1 second, a moment, no time at all. And that's true. It's an instant that you make that first impression with your audience. And so in that instant, how much content have you shared? How much of your story have you shared? How much have you let the audience know that, that you've thought about them and this is from their perspective? How much of your key message have you shared? How much engagement have you been able to have? None. It's just you right now. And so we're making those first impressions, not based on what we're saying or how we're planning, but what we're doing with our physical body. And so I'm going to talk you through the way in which you can make a confident and competent first impression in any audience, both in a live setting and a virtual setting. Let's start with live. It's the same skills for live and for virtual. Eye contact, voice, posture, and gestures. In a live setting, your eye contact is one that you want to make sure you're connecting with the audience. If any of you have ever traveled, taken a plane anywhere, you know that when you walk up to the desk at the gate and you're waiting there to speak to an attendant, there's a very specific action that happens that tells you it's time to start talking to the gate agent. And if you're thinking to yourself, what is that? They look at you. What happens if you start talking to the gate agent before they look up? Oh, you are not getting that upgrade. You are not getting your bag on the plane. None of the good things are happening. But if you wait until they look at you, that is the universal sign of let's connect. So in a live setting as a presenter, the technique that we teach for eye contact is to find a set of eyes to make a point, pause silently to find your next set of eyes to make your next point. Now I'm looking off camera, but you can see that the technique really involves looking to someone, making a whole point, pausing silently for the next person, and making your next point. This does a couple of things for you. It allows you to have a calmer cadence as you're practicing that eye contact, and it allows you to avoid those pesky vocal pauses. Anyone have a favorite? So, right? We all have them. And the eye contact skill of finding a set of eyes to make a point, pausing silently to find your next set of eyes, allows you to remove some vocal pauses and create a calm cadence in your vocal tone and the way that you're speaking. Speaking of vocal tone, voice is your connection to animation. The louder you get, the more animated your entire body becomes. You'll notice this if you are at a sports game or something. Everyone's loud, everyone's vibrant, their posture and their gestures and their facial expressions are big and loud. And so anytime we're with a speaker and we say, we want you to have more presence, we tell them to get louder. Now, volume, unfortunately, is not decided by us. So we don't get to decide what the right volume is. It's our audience that gets to decide. And so if you're in a big room giving a presentation, have a colleague or a friend stand in the back and test your voice. You're going to want to be louder than you think. So on a scale of like 1 to 10, you want to be in that 6 or 7 range, because you never want the low volume that you have to make it hard for people to hear your point. And you never want that to diminish the energy and animation in your voice and your body and your facial expressions. Gestures. Now, there's lots of common gestures that people use when they're presenting. We see people hold their hands behind their back, and we often call this when someone's getting grounded. You know, they're sad, their hands are behind their back, or maybe their hands are in front of their body and held right in the center of their body. We often call that the fig leaf. And we also have, the windshield wiper, where your arms are crossed and you're using one hand to gesture. There's all of these different types of gestures. And so what do you do with your hands? If you're saying to yourself, Tara, I'm a hand talker. If you haven't noticed yet, I am too. And that's okay. The thing you want to do with your hands are keep your gestures and hands, arms down by your side when you're not using them. Then gesture to add emphasis to your content. So we call that explanatory gestures. We went this far. We think this big of a difference. This is going to be our plan. Open explanatory gestures adds emphasis to your content and helps people remember it more. What about posture? Now, posture, we see all different kinds of things. We see rocking, we see movement. We're going to do virtual in just a moment, but in a live setting, the most powerful, confident pose you can have is your 2 feet placed about hip distance apart on the ground, planted, versus crossing them in the center, sort of like, this gives a different impression of me, than confidently with my 2 feet planted, arms at my side. This confident position allows the audience to see that I'm here, I'm ready to present, and I'm confident in front of you. Any other body posture or motion or gestures starts to change the perception the audience has of you, because you're giving them information about how you might be feeling on the inside. Maybe you're a little nervous, maybe you're feeling a little uncomfortable, but if you can use those gestures effectively and positively, it's going to make sure that you remain in control and show that you have the confidence to be there. And in terms of image, always dress to match the audience that you're speaking to. Sometimes we talk to clinicians and they say, I'm giving a talk to other clinicians who are going to be in scrubs. Can I wear scrubs? My philosophy of communication is there is never a right or wrong, but you want to be seen as the person who is in charge of this meeting and leading this talk. So dress just one level above what you think your audience might be at, and avoid anything that might distract you. So if you're someone who likes to play with a watch or a ring or a lapel, remove those items so that you're not distracted or feeling like you might mess with them as you present. And then into virtual skills. So it's the same techniques, eyes, voice, posture, gestures, and image, but just done in a slightly different way. When you're on Zoom, you want to add energy in your voice and in your gestures. And you want still, calm eyes and still, calm posture. And here's why. Eye contact on Zoom comes out very clearly. You really see it on any sort of mediated format. So I'm going to give an example with my eyes right now. If I'm looking around my screen, so here's what we're going to do with this talk. My eyes are moving all over. To you as the audience, it looks more chaotic and my energy is coming out in a way that's not effective for me to show confidence and competence. Instead, my eyes are calm and directed toward the camera so that I can make, as good eye contact as I can with those of you out in the world. And for posture, I want to remain still in my posture. So if I'm standing right now, but I wouldn't want to be doing this because any motion like this in a video format comes out as much bigger than it does in a live setting. Every movement we make really comes across bigger. So still eyes, still posture in a virtual setting. You can also sit, but make sure you're avoiding like a swivel chair or any other movements that are going to add that movement to your screen that's a distraction. But how you add energy is in your gestures. Use them as you will. Try to get them up near your face so that they're within the camera versus down here at your waist like you might do in a live setting. And then your voice. The challenge I always give everyone I work with is I tell them, speak as if you are giving the presentation in a live setting. So if you were in my office with me right now, you would be like, wow, Tara, too loud, too much. However, as the speaker, you can, on your side, can turn my volume down. You can make me quieter. But by having this big voice and using this big energy, you cannot remove the animation that's in my voice. So as quiet as you want to make me, I still have inflection and intonation that creates engagement and keeps you engaged throughout my talk. And in terms of image, you want to be mindful of how you fit in with your background. So if you have a white background, being mindful of wearing a white shirt or a dark background with a dark shirt, trying to stand out, having the appropriate lighting and your screen or your camera about eye level on your desk. And in this, I thought about industry partnerships. So if you want to work with industry, they're going to teach you these skills to present on topics that they have products, medical devices, drugs, different things. They're always looking for the most polished and confident seeming speakers. And so those skills are going to help you get to that point, to have that polish and appear confident so that you can show up well and show your competence in any setting. The 5 tips I had for you today were to tell a story, tell it from the audience's perspective, focus on key messages, add engagement, and work on your nonverbal physical delivery skills. It's been a pleasure talking with you today, and I look forward to answering any questions and staying connected with you after the program. So how can I help apply these tips to your work and your life?
Well, thank you. That was incredible. I'm feeling convicted. I feel like you took a list of all the things that I don't do well, as I'm not even looking at the camera right now. So
you look great.
Really incredible.
Yeah.
Well, thank you. So, I just want to highlight so much of what you said. I want to reinforce it because I think a lot of times I go to many of these meetings that you discussed with industry, and at nearly every one of these meetings, we have someone in there that is there to give some sort of public speaking or communication training. And a lot of times I hear from people, they get annoyed or they feel like they don't need it. And I think there's just always things that we can improve on. And communication, I was thinking about this in terms of non-clinical jobs. I can't think of a single job in healthcare, either clinically or non-clinically, where effective communication doesn't make you more marketable, make you more effective at what you do. So much of this industry is being able to tell a story, be a good narrator, or be a good educator. So it really is just such an important thing. And I hope that everyone watching this that has interest in various non-clinical activities will be able to recognize the value of this talk as it relates to whatever your pursuits are. So it looks like we've got some questions rolling in and lots of praise here. Oh my goodness. So let's start with some of this. So fantastic presentation. Even with my prior speaking experience, you had so many great techniques, and I will be reviewing your slides and recording to prepare for several upcoming presentations. That's awesome, Dan. Thanks for that.
Good luck.
Okay, my goodness, I'm having difficulty sifting through to look for questions because everybody is just giving praise.
I see one that's talking about my headset, and I'm thrilled that I'm coming across clearly, but I'm just using a pretty standard headset for, like an Apple device. But I do recommend, here's something. Sometimes I see people wearing like a big headset across their head and they think maybe that will help with sound. It might make you sound better, but what it does is create more of a mediated perspective. And so I always recommend a low profile headset for whomever is using it. And one thing I know is it's not near any necklaces. It's not near anything that could knock around. I'm mindful of, I'm keeping things very simple. And I'm also making sure I don't look too mediated. We're already between me and the screen. I want to make you feel like we're just sitting across from each other having a nice chat. And I don't have any like big headset and telemarketing kind of perspective on that makes it feel like, wow, she's really going for it with the presentation.
Excellent. So like I said, lots and lots of people just praising the talk, but I have a question for you, and we'll certainly give a little bit of time. We have 9 minutes. So if anyone has questions, please bring them in. But you have a great setup. Your lighting is great. There's photos in the background, but there's no glare from, if you have a ring light or something else that's lighting you from the front, I'm not seeing any glare on the photos in the background. So as we're talking about headphones, can you maybe just give some commentary in the virtual space of getting a good setup? Because I've watched so many medical education presentations, not only with headsets on, but poor lighting, poor sound, and it really does take away from the experience. And I think that's such a big part of communication. So any thoughts on having a setup for virtual that is conducive towards that confidence and confidence?
Yes. And I will say it is a trial and error. This is the scientific method. Absolutely come to life is creating your good setup. So, I love that you say you can't see my ring light. If I move my head slightly, you can kind of see it behind there. And this is one of those things you see those pictures online. They're like, what I look like on camera, and then what does it look like behind the scenes? And it's totally different. And so before I started today, I had a light in the corner that was new, and I put kind of a frame around it so that it wouldn't shine in the back. And I was being really mindful in my setup as I got in. I sat down and I said, where do I need to be? How do I want this arranged to make sure that you get exactly what I want? I have a ring light, but it's more of an LCD. And after this session, I could share with you like the list of things, Mike, and you can hand it out to the group of, I am on a riser. My laptop's on a riser. I'm using my laptop camera, not anything else, not an external camera. I have a ring, like a LCD light, and I'm creating lighting in the room. I also shut the blinds to make sure that there's not glare. But this is something I did about 30 minutes before I joined, is I got on a Zoom by myself, set everything up, make sure that this is how I want to appear. And then you just trust it. And you say, that's how we're going to flow for the rest of the talk.
I love it. And it'd be interesting for all of us to share our setups, because I've got 2 ring lights going. I've been battling sun, so if anyone is watching, my light levels drastically change. It's sunny in Buffalo in January. I don't know what's going on. I'm confused by it, but I'll take it.
Yes. Yeah.
All right. Chris says here, do you provide feedback on presentations?
We do. Yes, thanks. I'm going to put into the chat both on the next slide, there's some links that the people who get the slides will be able to access, but connect with me on LinkedIn. You can subscribe to my newsletter, Talking Points. And then we also do coaching, and we work with people, both intact teams through companies, as well as we can do some individual coaching. And so definitely reach out and we can work with what makes most sense for you and what you're working on.
Wonderful. And we've got Miriam. What are some tips for delivering a good intro in a talk? I always feel like I'm supposed to make a joke. Miriam, I've seen you give a talk, and you are an excellent speaker.
Miriam, I'm glad you're bringing that up. What I always say about an intro is to think about what you want out of this talk, and then think about what you think your audience wants out of this talk, and to find something that aligns you in the middle. Now, jokes are a very specific skill that I would highly recommend be used with very limited use. And the only way that humor will work as an intro is if it's self-deprecating. So like, oh, I, got lost on my way here because I can't find the way, so I'm the butt of the joke. Or it's something that we all experience together. Like, wow, the lights went out during lunch. I hope they don't go out during this talk. That's an experience that we all have together. Otherwise, you really don't know how your joke or your humor is going to land with someone else. And so typically, I don't recommend it. But any type of intro. So when I talked about those engaging openers, questions, stories, anecdotes, facts, those not only create engagement, they create engagement at the beginning. And so those can be the frameworks that you use when creating an opening at the beginning as well.
Wonderful. So it looks like we've got about 4 minutes left, so I'm going to give everyone one final chance to get any questions into the chat. But as we're waiting, just to make sure there's no other questions, thank you so much.
Oh, it's great to be here.
Yes.
This is awesome.
So I don't know if I'm going to run into you in the next few weeks, but I feel like I'm at trainings almost every weekend. So I hope that one of them you'll be there and we'll be able to catch up.
I hope so too.
Otherwise, it looks like we're good on questions. So Tara, thank you so much. And as she said, we're going to pass the slides along to all registrants. You'll get the slides at the end of this. We'll also make sure to include the contact information, because the goal with this is to make sure that we can empower all of you as attendees to not only gain this knowledge, but then also start to network and connect with these people so that we can make those next steps in looking for those non-clinical options.
That's great. Thanks so much.
Thank you so much.
Take care, everybody. Thanks for having me.
All right. Wonderful.